Hi, and thank you for inviting me to talk to you guys today about COVID-19 vaccine hesitancy. So I have no disclosures, no actual or potential conflicts of interest in relation to this presentation. Today, I hope to cover two specific things. I hope to talk about the psychosocial and cultural factors that it might impact COVID-19 vaccine hesitancy. And also, I hope that everybody can walk away with some specific strategies to foster vaccine confidence. So, what do we mean when we're talking about vaccine hesitancy? Well, the SAGE work group on vaccine hesitancy defines vaccine hesitancy as referring to a delay in acceptance or refusal of vaccination despite availability of vaccine services. Vaccine hesitancy is complex, it's context specific, it varies across time, place, and it actually varies across different vaccines. It's influenced by three specific factors: complacency, convenience, and confidence. And we'll talk more about those in a bit. The term vaccine hesitancy actually encompasses a continuum of individuals who range from individuals who might accept vaccines but still remain a little leery of them afterwards, to those who might delay vaccines, accept some vaccines and refuse others, or individuals who refuse all vaccines. One term you might be seeing in the literature lately is vaccine resistance. And this definition of vaccine hesitancy would actually encompass individuals who are vaccine resistant as well. So individuals who might be refusing all vaccines. So going back to some of the different factors that impact vaccine hesitancy. So three specific areas. Vaccine confidence. You can kind of think about vaccine confidence as trust. And it's trust in the effectiveness and the safety of the vaccines, and also the systems that deliver them. So that means trust in your medical providers, your healthcare providers, trust in health professionals, and trust in policymakers that have been influential in creating the vaccines. Vaccine confidence also exists on a continuum, but it's only one factor that impacts vaccine hesitancy. Vaccine complacency. You can kind of think of this as sort of like weighing the pros and cons for each individual on whether or not they want to get a vaccine. And this occurs when the perceived risks of a vaccine preventable disease are perceived as low. So then individuals may view vaccination as unnecessary. And this may be related to one specific vaccine, or it might be how individuals view vaccines broadly. And it can also be influenced by other competing demands that are occurring for an individual at a given point in time. Vaccine confidence has to do with the degree to which vaccines are delivered in a time, a place, and a manner that's appealing, convenient, affordable, and comfortable for individuals. We'll continue to look at these three factors as we talk about specific subgroups of individuals who might be experiencing more vaccine hesitancy. So let's look at how these three factors might influence intention to get the COVID-19 vaccine. So one study surveyed 934 participants on their intention to receive the COVID-19 vaccine. Of this group, 50% were women, about 75% were non-Hispanic Caucasians, 12% were Black or African American, 4% were Hispanic, and about 7% were Asian, Pacific Islander, or Native American. So in this study, concerns about the safety of the COVID-19 vaccine had a negative direct influence on vaccine intention and a negative indirect influence on vaccine intention because it impacted people's views on the COVID-19 vaccine. And so when we're thinking about vaccine safety, this really highlights how vaccine confidence comes into play when it comes to intention to get vaccinated. So let's consider how vaccine confidence, complacency, and convenience can impact intention to get a COVID-19 vaccine. So one study surveyed 934 participants in their intention to receive a COVID-19 vaccination. Of this group, 50% were women, 75% were non-Hispanic Caucasians, just over 12% were Black or African American, and about 4% were Hispanic, Latino, and 7% were Asian, Pacific Islander, or Native American. So when we're looking at vaccine confidence, again, this talks about trust and safety in the vaccine. So here what we found is that concerns about safety negatively impacted vaccine intention, both directly impacting vaccine intention and also indirectly, because it impacted participants' attitudes towards the COVID-19 vaccine. Now, when we're looking at vaccine complacency, again, this is the weighing the pros and cons, the individual decision as to risks and benefits of a specific vaccine. There was some interesting information that came out of this study. One has to do with this optimistic bias. So here, even though the vast majority of the individuals in the study viewed COVID-19 as a severe health risk, the perceived susceptibility was significantly lower than the perceived severity. So what this highlights is that individuals tend to underestimate the risks of contracting or experiencing severe outcomes for COVID-19 when they're thinking about themselves as an individual. So they think that they're less likely to have negative outcomes associated with COVID-19, which would impact their decisions regarding vaccination. Interestingly, and on the other side of things, fear of COVID-19 was associated with a positive intention to receive the vaccine. And so this also highlights that if you're considering personal risks and fear and incorporating that into your messaging can be particularly helpful for populations who might think themselves less likely to have negative outcomes. And again, vaccine convenience has to do with how easy it is to obtain the vaccine. And so here, providing vaccines at a reasonable cost or free was associated with intention to obtain the vaccine. And perceived benefits to the community were also both directly and indirectly associated with vaccine intention. So let's look at some specific subgroups. So there are a number of specific subgroups who have a lower self-reported likelihood of obtaining the COVID-19 vaccine. And this has been across some different studies, but it seems to be pretty consistent across those studies. So women are often less likely to report intention to get the COVID-19 vaccine. Younger individuals are less likely. Black individuals or African American as compared to white individuals, and individuals with a high school education as compared to those with a bachelor's degree are often less likely to report intention to get COVID-19 vaccines. So looking specifically at younger individuals, as we just mentioned on the last slide, they're less likely to report intention of getting vaccinated from COVID-19. So let's look at some of the factors that might be influencing their decision. So historically, prior to the Delta variant, individuals in this age group were less likely to have severe COVID-19 hospitalization or death. And so that can definitely impact vaccine complacency as they're weighing the pros and cons of personal risk to themselves. This study also broke it out into individuals who were unsure or probably going to get vaccinated and individuals who were not planning on getting vaccinated. So 23.2% of individuals reported that they were probably going to get vaccinated or unsure, while almost 25% reported that they were probably not or definitely not getting vaccinated. And they had similar concerns across the board. So concerns about vaccine side effects was similar with both of them, while individuals who were unsure or probably going to get vaccinated had a preference to kind of wait and see if the vaccines were safe, or they thought other people might be more in need of the vaccines than themselves at that point in time. Individuals who were not planning on getting vaccinated had a lack of trust in the COVID-19 vaccines or did not believe the vaccines were necessary. So here again, the vaccine confidence coming into play and also vaccine complacency. When we're looking at this group of individuals together, the 18 to 39-year-olds, they found that age, education, and income were all associated with greater intention of getting vaccinated, with older individuals, those 35 to 39, those with a bachelor's degree, those with higher education or higher income being more likely to get vaccinated. Non-Hispanic Black individuals were less likely to get vaccinated than white individuals, or less likely to report intention to get vaccinated, I should say, than white individuals. And those living in rural communities were less likely to report intention of getting vaccinated. They were more likely to say they were probably or definitely not getting vaccinated than individuals in metropolitan areas. So, looking at vaccine convenience, the convenience of obtaining a COVID-19 vaccine does not appear to be a primary factor in decision making for younger adults who said they were probably or definitely not intending to get vaccinated. Barriers to obtaining the COVID-19 vaccine were only reported in 5% or less of this subgroup. And really, the one that was reported most consistently, but again, only 5% of the subset were that they were just too busy to get the vaccine. None of the other potential barriers were reported by any more than 2% of the population. Like younger adults, African Americans and Black individuals also reported greater COVID-19 vaccine hesitancy. So in this study by Malik and colleagues, we found that Black or African American individuals experience greater vaccine hesitancy as it applies to the COVID-19 vaccine, where only 40% planned on getting the vaccine, and the flu shot as well, where there were 42% who said they would, who had actually received a flu shot recently. So what are some of the factors that might be coming into play with vaccine hesitancy for African American or Black individuals? This study was a series of focus groups that was conducted in summer of 2020 amongst Black-owned barbershops and hair salons, and it used a grounded theory approach to identify different themes that might be contributing to vaccine hesitancy. So this was a small group. It was about 24 individuals. 89% were non-Hispanic Black individuals, and 79% of the participants, were women. So some of the themes that emerged from these focus groups were a belief that the vaccine development was rushed and therefore was unsafe. Also concern that the COVID-19 vaccine was linked to beliefs that some individuals held about vaccines in general, that they're either ineffective or they actually result in an infection. So for example, one of the beliefs that was held by some of the participants was that the flu vaccine actually gives you the flu. And so they were hesitant to take a COVID-19 vaccine for fear that they would actually be receiving small amounts of the COVID-19. And long and short-term effects of the COVID-19 vaccine were also a concern for individuals. And then it's very important to note that there is considerable and well-founded mistrust of the medical establishment, researchers, and pharmaceutical companies, given past mistreatment of Black and African American individuals by these groups and by the government and medical research broadly. Additionally, inconsistencies in messaging from the federal, state, and local guidance during the pandemic contributed to low confidence in government-led vaccine initiatives. Concerns about the possible role of politics in the scientific process were also expressed by participants in the focus groups. And in particular, the fact that some of these vaccines were developed in a political environment that fostered white supremacy and racial injustice, and any connections to President Trump was also a theme that was noted by participants in the study. And they felt that those factors undermined vaccine confidence. So now let's look specifically at individuals with HIV. And here too, we see how medical mistrust and vaccine hesitancy are interrelated for Black Americans, and particularly those with HIV. So this study looked at a convenient sample of Black individuals, many of whom identified as sexual minorities, all of whom had HIV, and they were living in the greater LA area, participating in another study, in fact. Here, questionnaires were administered between May and July of last year, before the COVID-19 vaccine was actually available. So this is a hypothetical response regarding vaccine hesitancy, as many of these studies have been. And this study found high levels of general mistrust related to COVID-19 broadly, and they largely focused on the government's role in addressing the pandemic. So participants reported high levels of general COVID-19 mistrust. They were given a survey, and 97% of the participants in the study identified at least one area of medical mistrust on this. So the vast majority of participants endorsed at least some medical mistrust. More than half of the participants in the sample believed that a lot of the information about COVID-19 is being withheld by the government, that the government cannot be trusted to tell the truth about COVID-19, and that the government is hiding information about COVID-19. And a greater COVID-19 mistrust was directly associated with lower willingness to get the COVID-19 vaccine, which makes sense again because vaccine confidence has to do with your trust in the vaccine and your trust in the people administering the vaccine and the people who have been influential in the vaccine development. So the more mistrust you have, the less likely you are to have confidence in obtaining the vaccine. One really important factor that we're seeing in this study, though, is that while there's a lot of general and governmental mistrust regarding COVID-19, Black Americans with HIV had a lot of trust in their specific medical providers and healthcare providers, which I think is hugely important when we're talking about how we specifically can help our patients and clients foster vaccine confidence. So 74% of the participants in this study endorsed that providers have the best interests of their patients in mind and actually identified service providers and healthcare professionals as the most trustworthy source of information. So not only do they already trust their providers, but if they get additional information from their providers, they're more likely to trust it. And ideally, they're more likely to come to providers with questions, given that they're a trusted source of information. Now, when it comes to fostering vaccine confidence, I have good news and I have bad news. So let's start with the bad news first. The bad news is there is no silver bullet to tell patients, friends, or loved ones that will increase vaccine confidence for all folks. Despite the fact that I seriously wish there were. However, the good news is chances are you have had a lot of expertise in navigating behavior change conversations, and you might not even realize it. So stepping back from vaccine hesitancy and confidence for a minute, there are likely to be other behavior change conversations that you've had with your clients or your patients in the past, whether it's adherence to antiretrovirals, smoking cessation, reducing substance use, or even, being adherent to a statin. Many of the strategies you use to address these behavioral changes are likely to help facilitate conversations with patients on vaccination as well. So again, vaccine confidence, which is what we're trying to bolster here, has to do with trust and safety and effectiveness in vaccines, trust in healthcare professionals, public health and healthcare systems, and policymakers. To assist in building trust, the CDC also recommends a few additional things: getting vaccinated yourself, and then having a visible demonstration of that vaccination, whether you're wearing a button, a sticker, a lanyard, posting on social media, sharing your experiences. What were your side effects like? What can patients anticipate? That personal information can be really helpful for patients in making these decisions. Additionally, if your healthcare service institution has access to peer support specialists or peers who are comfortable talking about their vaccine experience, that can also be a nice partner in this discussion. So here are some steps that can be helpful in fostering vaccine confidence. So before even initiating these conversations, it can be helpful to reflect on your own reactions and biases regarding vaccine hesitation. This is a highly charged issue. I'm sure that you have had a number of discussions with different people about it. And knowing your own perspectives, knowing what buttons can be pushed for you and your own biases can help you navigate these conversations more masterfully. And then the second step, which is really important, is also fostering trust. Now, chances are with your patients, fostering trust likely started days, weeks, or years ago. And a big part of fostering trust is being honest and transparent. And that includes the things we know and also the things we don't know. It can be really profound for patients to hear that there are things that we don't know. When we try and explain things that aren't supported by the research yet, patients see right through that. And so being really transparent about the things that we don't know yet can be important. And also, it's important to create a safe space for patients to ask questions without judgment. Again, the without judgment part is important, is why we have this first step about checking in on your own reactions first, so that we can better be so that we can be better prepared to address those in a non-judgmental way, both in what we say and also in our nonverbals. So then we want to understand motivational factors, and we'll talk about some specific motivational factors for different subgroups, but what you really want to understand is the patient or person sitting in front of you. What are their cons and pros to getting the vaccine? And I said cons first and then pros because when you discuss them with your patients, I would encourage you to start with the cons so that you end on the benefits of the discussion. So what would tip the scales for patients? What are their cons? What are their pros? And then also what tips the scales for them? And if a patient is ambivalent about getting a vaccine, I may ask them when they would know that it's time to get one. Not only does that help you understand their motivation, but it can also kind of help them set up red flags. Like if this happens, it means something has shifted and I should go get vaccinated. And then the last one is addressing misinformation. And I intentionally left this as the last step. We as providers often like to start here, right? We think that if we can just correct misinformation, it can be a quick fix to changing people's perspectives. However, it's really crucial that you foster trust and that you understand individuals' personal motivational factors prior to addressing misinformation so that we can do it in the most effective way possible. And we'll talk about specific examples of how to do that later on in the conversation. So when we're looking at younger individuals, there are a few things that might be helpful in this discussion. So highlighting that vaccines are safe and effective and will help individuals resume social activities can be more motivating for individuals who are unsure about getting vaccinated. And if you look here, information about showing how vaccines are safe can also be impactful for individuals who are probably not or definitely not getting vaccinated. So that's definitely something to consider there as well. And now when we're looking at how can we help bolster vaccine confidence among Black or African American individuals, some of the themes that came from those focus groups were reporting limited adverse side effects, or at least walking people through what the side effects might look like and how long they could expect to experience them. And then transparency regarding the vaccine development. That can be really helpful for people to know about. Recommendation from a trusted provider. Again, ideally, you've already built trust with this individual for all of the other ways in which you've helped care for the individual in the past. So providing that information and addressing any misinformation can be really helpful here. And again, with addressing misinformation, addressing beliefs that the vaccine can actually cause infection will be important. In fact, the concern that it causes infection was particularly important and meaningful to individuals who reported underlying health conditions, which would be a population in particular we'd want to target to get vaccinated. So how do we tackle misinformation? So first, I would encourage people to incorporate motivational interviewing tactics when tackling misinformation. One strategy in MI is to actually ask permission to give information first. And it might seem counterintuitive, but it can be really helpful in fostering trust and buy-in. One way that I phrase it is I say something along the lines of like, I have some information on X. Would you be open to hearing about it? And if they say no, honestly, you let it lie there. You'll have more opportunities to have this conversation with people if you respect when they ask you to not share information. However, I often find that people, if you open with that, they're like, yeah, sure. What do you know? And so here are some of the specific strategies I like to use when tackling misinformation. And these were actually recommended by a group out of the Mayo Clinic too. So I would encourage you guys to check out that reference if you have any more questions. So one is increasing receptivity to information by framing it in a manner that affirms the patient's values or worldviews. So this is why it's really important to have trust and to know your patient's motivations before you address misinformation. So you want to include something that's relevant to the patient. So like one example might be, I know you're concerned about your health and worried about how the vaccine may impact it. That shows that you know the patient, that you know what's kind of driving their decisions, and that you can give information from there that's related specifically to their values and concerns. Or I can see that caring for your whoever their loved one is they might care for is your priority, and then addressing how being vaccinated might assist with that process and help protect them. Next, you want to explain the motivation behind vaccine misinformation and provide a factual alternative. So I can see why you feel uneasy given how quickly these vaccines were developed. In fact, there are a number of steps that were required to occur before the vaccines received emergency use authorization. And I can walk you through those if you'd like. And it can be really helpful to have a picture or like a visual representation of how this process goes. There's a lot available on the CDC if you'd like to help talk people through that process. And then you want to reiterate the information you've already shared so you can strengthen those neuronal networks for accurate information by repeating it again. And use clear language whenever possible. So in summary, these vaccines were rigorously studied, are safe, and can help you protect you and your family from severe COVID-19 symptoms. So a lot of the strategies we talked about today have to do with specific like patient-provider interactions, and it's a more one-on-one situation. Now, there are a number of different strategies that can be used at a health systems level and at a community level. And this reference here from the Mayo Clinic has some different options in there, and I would encourage you guys to check that reference out. Additionally, I've included some resources here that are provided by the CDC for building vaccine confidence, a vaccine confidence toolkit, and the State of Vaccine Confidence Insight report. So that last report can be really helpful in understanding what are some of the specific concerns that are circulating right now regarding COVID-19 vaccines. How likely are they to impact people's decisions about vaccine, and in what direction? Are they likely to facilitate it, or are they likely to create more hesitancy? And that's updated periodically. So that can be a nice touch point to see sort of where things are at this point in time and how you can best tailor your strategies if need be. I have included my references here for any additional research or interest. And I appreciate everybody's time today. Thank you very much. And thank you for all you do to help foster vaccine confidence in your patients moving forward.